Have you ever had pain right here in the backside of your hip, or a vague pain, numbness, or tingling in the back of your thigh that you thought was a pulled hamstring? I'm Dr. Leslie, and this is Behind the Scenes with Elite Concepts. I'm here talking to you today about Piriformis Syndrome. Symptoms in the buttock and leg are often termed sciatica because the symptoms follow along the sciatic nerve. The thing is, though, the term sciatica doesn't actually diagnose the source of the problem. It really just describes where the symptoms are. So it's sort of a catch-all term that usually needs a little further examination to get to the root of the problem. So one of the possible causes is a condition called Piriformis Syndrome. If you've been in ACL Strong, you've heard me talk a lot about the piriformis muscle, where it's located and how to stretch it. The piriformis muscle is a small pear-shaped muscle located deep in the buttocks beneath the larger gluteal muscles. Its job is to assist in the rotation of the hip and help stabilize the hip joint, which is a ball and socket joint that connects the leg to the pelvis and spine. So it's actually part of the core. Now, the sciatic nerve, which is the largest nerve in the body, runs directly beneath and sometimes through the piriformis muscle. So when the piriformis muscle spasms or is tight, it can compress on the sciatic nerve, leading to pain and discomfort. So why might this happen? For one, trauma. An injury to the piriformis muscle or a direct blow to the surrounding structures can cause inflammation and compression of the sciatic nerve, and that can give you symptoms. Two, overuse or repetitive activities. So activities that involve repetitive movements or prolonged sitting can actually put pressure on the piriformis muscle or strain it and lead to symptoms. Thirdly, muscle imbalance. Weakness or tightness in the surrounding muscles can lead to compensatory changes in the piriformis muscle. And lastly, anatomical variations. Some individuals have variations in the anatomy of the piriformis muscle so that the sciatic nerve can be a little bit more susceptible to this condition. The condition can be aggravated by sitting for prolonged periods, especially on hard surfaces. It can put pressure directly on the piriformis muscle from the sciatic nerve. It can also be aggravated by a lot of walking or running or climbing stairs or activities, again, that involve repetitive hip movements. It can even be aggravated by heavy lifting because there's a demand on the muscles of the lower back and the posterior hips, including the piriformis muscle. So whenever I suspect that piriformis syndrome could be at play, then I want to apply strategies to relax the muscle, release tone, and allow it to work through the healing process. So this is one of those times where aggressive massage or using a Theragun or something directly on the painful spot might further aggravate it. I've actually done this to myself, and the numbness and tingling got worse right after. So I had to then back off and be more intentional with my treatment. So first, as always, you need to stop re-aggravating it. Know your limits and make modifications. If you don't keep repeating the same trigger over and over, that'll keep you in that cycle. Next, I'll show you one stretch that I like to use. It's called a contract-relax stretch because it can reduce muscle tone and allow access to more length in the muscle, thereby reducing compression of the underlying nerve. So the best stretch for Piriformis Syndrome. All right, we're going to do the Piriformis contract-relax stretch. We'll do it two different ways. So first I'll do it sitting, and then I'll do it lying down. Now, if you do the sitting way, it can be a little uncomfortable if you have sensitivity sitting on a firmer surface. So if that's the case, then you might choose the lying down option. So sitting up nice and tall, I'm going to take the affected leg and I'm going to cross it over the other knee. Same hand reaches for the knee, opposite hand reaches for the ankle. And you can sit up tall and give a gentle stretch, bringing the knee towards the chest and opposite shoulder. Now, when you do this stretch, I don't want you to pull into pain. If you have pain, then just back off a little bit. So it's a stretch, not a pain. From here, we're going to do a contraction. So you're going to drive or press your knee into your hand and resist it. Same thing at the ankle. We're going to push that down into the knee or resist it with the hand. Okay, so I'm going to go ahead and press. Not a max contraction, just a nice gentle contraction to engage the muscles, and then resisting it with my hands. Still going. We're going for about 10 seconds, and then relax, and you pull just a little bit further. You'll notice that immediately after the contraction, you get a little bit better stretch. Let's do it one more time. So hold for about 15 seconds, and then we're going to press again, do the contraction, press the knee into the hand, ankle into the knee, sitting up nice and tall, 10-second hold, and then relax and pull a bit more. You can do that 2 or 3 times. And then when you come out of that, you should be left in a little bit of a lengthened position to take pressure off the sciatic nerve. Okay, now we're going to try it lying down. So from a lying down position, feet bent, feet flat on the floor, we're going to take the involved leg, cross it over the other knee, reach and hold behind the knee and behind the ankle. And again, same thing, you're pulling in towards your chest and opposite shoulder. Sometimes the tendency is to push this knee away. That's not what we're doing in this stretch. We're bringing it in. Again, recognizing how far into pain you're pulling. We don't want to pull into pain. Find that spot and then back off a little bit. Now we're going to do the contraction, pressing the knee into the hand, resisting it, pressing the ankle into the knee, resisting it. 10-second hold. And as you relax, go a little bit further in the stretch. Hold here, 15 seconds. Okay, we're going to contract again. Press the knee into the hand, press the ankle into the hand or knee. Again, not a max contraction, a gentle contraction, so we're engaging the muscle. And relax. And we'll go into a little further stretch. Good. And then sometimes I like to kind of wiggle it as you come out of that stretch. Keep in mind that this should be relieving afterward. If it makes your symptoms worse, then back off even more. A gentle stretch has to be gentle and not give you the reverse effect of causing more protective muscle spasm. I hope that makes sense. In conclusion, Piriformis syndrome can be pretty uncomfortable and can impact daily activities, but with proper understanding and management of the symptoms, it can be effectively relieved. Be sure to address the underlying muscle imbalances so that it doesn't come right back once you get rid of it. In our ACL Strong courses, we have foundational stretches for all sides of the hips, including the Piriformis stretch. And then, of course, we have the progressive strength and balance exercises to improve strength and stability all around the hips, legs, and core. All right, that's it for now. Thanks for watching.